These goals will honor the aspirations of the vast majority of existing HHS employees who actually yearn to make America healthy. 28 great divisions will become 15. The entire federal workforce is downsizing now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000. We're keenly focused on paring away excess administrators while increasing the number of scientists and frontline health providers so that we can do a better job for the American people. We're going to streamline our agency and eliminate the redundancies and invite everyone to align behind a simple, bold mission. I want every HHS employee to wake up every morning asking themselves, what can I do to restore American health today? I want to empower everyone in the HHS family to have a sense of purpose and pride and a sense of personal agency and responsibility to this larger goal. We're going to save taxpayers nearly $2 billion a year, and we're going to return HHS to its original commitment to public health and gold standard science. I want this agency to be once again a revered scientific institution that once made HHS the envy of the world. I want everyone who works here to be proud of this agency, to be proud of their work, to feel a renewed inspiration and their own sense of responsibility for our success in restoring America to good health. Streamlining HHS is part of a shift to new priorities, especially ending the chronic disease epidemic with clean water, safe food, effective medicine, good science, radical transparency, and a healthy environment. I think most Americans would agree with me that throwing more money at healthcare isn't going to solve the problem, or it would have solved it already. Obviously, what we've been doing hasn't worked. That's why we're making this dramatic overhaul. But the real overhaul is even bigger. The real overhaul is improving the health of the entire nation to make America healthy again.
Health and Human Services, HHS, is going to get a massive makeover. Secretary Robert F. Kennedy Jr. said he is going to be consolidating and downsizing, and we're going to get something called AHA.
We're going to eliminate an entire alphabet soup of departments and agencies while preserving their core functions by merging them into a new organization called the Administration for a Healthy America, or AHA. We have two goals. The first is obvious, to save the taxpayer money by making our department more efficient. And the second is to radically improve our quality of service.
According to a video announcement posted today, Secretary Kennedy said this massive restructuring of the Health and Human Services Department is necessary because he says the bureaucracy has gotten out of control. This restructuring is going to require firing another 10,000 full-time HHS employees. That's on top of the nearly 10,000 that were already cut by DOGE. On top of those personnel cuts, Kennedy says, HHS will take its current 28 divisions and will consolidate them down to 15 new divisions. He's also cutting the number of HHS regional offices in half, from 10 to 5. Kennedy claims all this restructuring is going to save American taxpayers almost $2 billion.
The entire federal workforce is downsizing now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000. We're keenly focused on paring away excess administrators while increasing the number of scientists and frontline health providers.
A fact sheet provided by HHS says the FDA will decrease its workforce by 3,500. The CDC will decrease its workforce by 2,400. The National Institute of Health will decrease its workforce by 1,200, and the Centers for Medicare and Medicaid will reduce its workforce by 300. As for this new AHA agency, Kennedy says it will combine multiple existing agencies that are already within Health and Human Services, including Substance Abuse and Mental Health Services, the Agency for Toxic Substances and Disease Registry, National Institute for Occupational Safety and Health, and more. Now, those who are part of Kennedy's Make America Healthy Again movement have praised today's announcement, but What is this going to mean for you? Well, we're going to have to wait and see how this all shakes out. But health advocates, including those who advocate for Medicare and Medicaid recipients, child health advocates, and infectious disease experts warn that massive cuts like this will absolutely impact all kinds of services that are available to the American public through the Health and Human Services Department. It will impact cutting-edge research and vaccine and treatment development for serious diseases. Kennedy says these cuts are necessary, and he is standing by this decision.
We are the sickest nation in the world, and we have the highest rate of chronic disease. The U.S. ranks last among 40 developed nations in terms of health, but we spend 2 to 3 times more per capita than those nations. We're going to streamline our agency and eliminate the redundancies and invite everyone to align behind a simple, bold mission. I want every HHS employee to wake up every morning asking themselves, what can I do to restore American health today?
So if you want to read more about these cuts to HHS, and if you want to see more about the restructuring of all of this, and you want to see...
So RFK Jr., Health and Human Service Secretary, getting ready to cut 10,000 jobs from the department. It's interesting enough that he want to cut 10,000 jobs but didn't want to cut heroin out of his life.
Ooh, anti-vaxxer just for kicks, man. Only needle Robert Jr. took was heroin. Though he ain't qualified, they confirmed him still.
I had to sit back for 4 years while y'all had so much shit to say about my nigga Hunter, but what's good for the goose is good for the motherfucking gander. I ain't Jesus, bitch, okay? I don't believe in turning the other motherfucking cheek. I'm a motherfucking Democrat that slaps y'all asses back. But back to this hemming and hawing motherfucker that desperately needs a haul. What's in the water? It's called fluoride, bitch, and it prevents teeth decay. Along with being dangerously racist by saying that black people have a stronger immunity than other Americans, he's also dangerously incompetent, dangerously unqualified. By making these cuts, these are the departments that are going to be affected. The FDA that handles our food and our medicine. The CDC that also monitors infectious diseases. The NIH that also deals with cancer research. This motherfucker is going to get us killed. RFK, let me tell you what you need to do. You need to resign and go back to your parents' basement where they can feed you a baby Ruth.
20% of the FDA and 20% of the CDC will actually be diminished. So is that how you make America healthy again? I'm just curious, because a lot of those positions are how can you prevent disease transmission? And they're saying that's exactly what they're going to focus on. But the problem is some of our most deadliest diseases are non-communicable diseases. And so you have a lot of chronic illnesses, obesity, high blood pressure, atherosclerosis. Those are the kinds of problems that are affecting the majority of people in terms of health outcomes. So if you also diminish some of the roles of the FDA, who's making sure that our food and drugs are safe, that they're legitimate, that they say what they contain and it's truthful. They're claiming that a lot of the positions they're removing are administrative roles in finance and in HR. And they're pointing to the fact that a number of these organizations have different HR branches and they're not communicating together. But a lot of experts are looking at this and thinking, how are you going to have the same quality in terms of the output of these organizations if you're removing 10,000 people from these agencies? It's pretty significant.
In a major overhaul, the U.S. Department of Human and Health Services will lay off 10,000 workers and shut down entire agencies, including ones that oversee billions of dollars and fund for addiction services and community health centers across the country. Robert Kennedy criticized the department he oversees as an inefficient, sprawling bureaucracy. In a video announcing the restructuring Thursday, he faulted the department's 82,000 workers for a decline in America's health. It's not the workers' fault, it's individual people's fault. I want to promise you now that we're going to do with more with less, Kennedy said in a video posted to social media. The reconstruction plan caps weeks of turmoil at the nation's top health department, which has been embroiled in rumors of mass firings, a revocation of $11 billion in public health funding for cities and counties, a tepid response to a measles outbreak, and controversial remarks about vaccines from its new leader. Kennedy said a painful period lies ahead for Human and Health Services, which is responsible for monitoring infectious disease, inspecting foods in hospitals, and overseeing health agency programs for nearly half the county. Of course they will. We won't have anybody to come out and inspect. Okay? We won't have anybody monitoring what they're putting in our foods, what they're putting in our vaccines. And this man says, make America healthy again. How is that going to make America healthy? It's going to make people die, be unalived more here, because we need these extra people to keep it going. And now the ACs are going to be condensed into 15, but he's making it like 15, making 2 departments into 1. And now it's like less is going to get done because you got 4 people doing like 6 jobs. It's going to get ridiculous. And then on top of that, they want to get rid of the unions. So I'm just like, man, like, people thought these government jobs were safe. They're not safe. They're not safe anymore. So, I mean, man, you guys, this is crazy. It's really crazy how they just doing stuff. But what the hell do I know? I'm just a talking head. Have a great day, YouTube.
The U.S. Department of Health and Human Services said on Thursday it will cut about 10,000 full-time jobs and close to half of its regional offices in a major overhaul of the department under Health Secretary Robert F. Kennedy Jr. The latest job cuts and about 10,000 recent voluntary departures will reduce the number of full-time employees at the department to 62,000 from 82,000. Great.
Health and Human Services employees. So I know you probably have seen, or you guys already know, all right, they want to cut that Health and Human Services by 20,000 people. 10K of those people are people that took the fork in the road or early retirement. So they need to cut another 10K. And a lot of them are going to be full-time employees. Now, whether they're permanent or probationary, I do not know. But they're trying to cut 3,500 from the FDA, 2,400 from the CDC, 1,200 from NIH, and 300 from CMS. Okay. They also want to reorganize. So they want to they want to reduce the number of divisions from 28 to 15. Okay. So a lot of people are about to stay overworked and underpaid. And then they also said they are doing this to make the department more efficient at a lower cost to taxpayers. However, all of this is only going to save $1.8 billion. The Health and Human Services budget is $2 trillion. That's less than 0.1% that they will save. Good luck. Stay informed.
Good morning, federal employee friends. Just a real quick update. If you haven't heard, RFK Jr. and the Trump administration are setting up to fire 10,000 employees with Health and Human Services today. Now, this is only going to further decimate the federal workforce. We'll see how these are likely to go to lawsuit, just like all of the other firings, and what's going to come from that. But as it's coming from RFK Jr., it's going to have less teeth than the previous firings that have come down through OPM. We'll have to wait and see how this works out. But right now, this is probably going to be the administration's new tactic going forward, where they say that the director of whatever agency is the one pushing the firings. So if you're with Health and Human Services and you're within that group that's going to be fired, which include individuals from Health and Human Services, the Center for Disease Control, the National Institute of Health, Medicare and Medicaid, and the Food and Drug Administration. If you work with those, you might be getting fired today. I don't have any more information. I'm still on vacation, but just needed to get this out there.
In breaking news, the Health and Human Services Agency, now run by your one and only RFK Jr., is severely cutting back the workforce. This is the agency that's responsible for monitoring infectious diseases, inspecting food and hospitals, and overseeing health insurance programs for nearly half of Americans. So they're planning on reducing the workforce from 82,000 to 62,000, plus reducing another 10,000 that are going to retire or take buyouts. The cuts are going to hit the FDA. They'll get rid of about 3,500 workers. The Center for Disease Control, they're going to get rid of about 2,400. The National Institute for Health, they're going to get rid of about 1,200. And the Centers for Medicare and Medicaid, they're going to lose about 300. And of course, that list is going to go on as we learn more. But this is going to have huge impacts as people need to obviously get access to benefits. Anyway, follow for more. We'll chat soon.
In case you missed it, we see now that Trump, the administration plans to lay off at least 10,000 people at HHS, which is the Health and Human Services Department of the government, and that will have major consequences on public health here at home, which is one of the messages that resonates most with people that on both sides of the aisle. So if you have a lot of Republicans that are kind of upset right now and you're looking at what resonates with them, we know from message testing and also from anecdotal experience that public health specifically is what resonates most. HHS specifically protects and improves the well-being of Americans. So that's everything from Medicare, Medicaid, the Affordable Care Act. That's everything from public health emergencies. That's everything from social services. So people with disabilities, seniors, people who can't get health care and need that kind of routine, highly skilled care, research on Alzheimer's, cancer, mental health, etc., and then regulations related to healthcare and social services. So this is one of the most important agencies for the health of Americans, and it looks like 10,000 folks are going to get the chop. That also means 10,000 folks that are going to have to be looking for jobs in an incredibly saturated job market. So watch this space. There's a chance a lawyer, comes through or a court comes through and says that this too is unconstitutional or that this isn't, the way that it should be done with a standard RIF. But for right now, the immediate consequences are that the folks in your communities and you yourself are going to be less healthy.